be a reminder as go to our communities. We have to do the work in our communities. We can't depend on anybody else.
Otansin totemtik tatamsratna ortigarkioraya kiuetno. Howard Big Head sigasun. Ota pevitapmarig mananida. Tahtoispäik eatsumutsik. Kahkio epik squatugui umutti kai kiuetno. Vitset maskegioinog. Maskegiusko ota. Eatusketsik, eatuskatahkiaguma. Aksuunga petatutsikaati kaimah etuitsik. Eksekwe mama okamattutsik. Ego mena kisto mama okamattuik, mama huitsituik. Tanssiki suu eistä moguma aksuun utihtue ahota. Mitset kipehtena oreas. Egi jäimä humattua aksuun. Pitus aksuun muuma mara. Päivän saarmreisiin ja hustirase uppme kutarau haskia atsema urukti aisinor asia rastnachum aksun atitminen päivutsi. Moi kuisegin taru maganan sihats evittämätaruk tavuistamek. Kiavaane po tämä mohamattu ei nantoagi desitsigik. Tapatsai on minäkin teek. Egun itse mstegi oiks keittämä tanssi peispäini. Egun minä maskegi uskoi katosketsik.
Every year when fall and winter come around, we in Canada experience flu season. Influenza or the flu is spread more easily in colder weather because more people are indoors more and in close contact more often. There is also research that indicates that the virus may survive longer in colder temperatures. In April 2009, a new influenza A strain emerged in Mexico and United States that combined genes from human, bird, and pig flu. At first called swine flu, the new strain is known as H1N1. Like common forms of influenza, it is typically transmitted through the air by coughing and sneezing, and cannot be caught by eating pork as some people believed. On June 11, 2009, the World Health Organization officially declared the outbreak to be a pandemic. The term pandemic is an indication that H1N1 is widespread around the world. It is not an indication of severity. In Saskatchewan, the impact of the pandemic has been for the most part mild. However, it is in everyone's best interest to limit the spread as much as possible and be prepared for the virus in our own communities. In northern Saskatchewan, even though our communities are small and spread out over a large area, we must be prepared as well. The Northern Intertribal Health Authority, or NITHA, supports health care for its 33 partner First Nations from across the northern half of the province. NITHA organized the Elders Forum to discuss the anticipated pandemic influenza. The elders were concerned that people in our communities may be more susceptible to the virus and that we needed to be better prepared. Prevalence of chronic diseases, poor ventilated moldy houses, smoking and poor diets may all contribute to more severe cases of H1N1. We can all work together to limit the spread of H1N1 in our communities. The main route of transmission of the new influenza virus is similar to seasonal influenza, by droplets that are blown out by speaking, sneezing, or coughing. The germs can also Rest on hard surfaces like counters, doorknobs, telephones, and keyboards. You can prevent getting infected by avoiding close contact with people who show influenza-like symptoms, trying to maintain a distance of 1 meter if possible. Proper coughing and sneezing techniques will also help prevent the spread of disease. Cough and sneeze into your sleeve and not into your hands or into the air. It is also important to wash your hands properly after using the washroom, smoking, or contact with contaminated surfaces. Do more than give your hands a quick rinse. Use soap, run warm water over your hands, and lather the soap for at least 20 seconds. Use a towel to dry your hands and turn off the taps. Other ways to prevent the spread of influenza are: avoid touching your mouth and nose, avoid close contact with people who might be ill, reduce the time spent in crowded settings if possible, improve airflow in your living space by opening windows, practice good health habits, including adequate sleep, eating nutritious food, keeping physically active, and not sharing food and drinks. It is believed a person is able to spread the virus to others for 1 day before the onset of symptoms to approximately 7 days after symptoms have started. A person with H1N1 almost always has a cough and fever. Usually an infected person will have fatigue, muscle aches, sore throat, headache, decreased appetite, and a runny nose. They will also sometimes have nausea, vomiting, or diarrhea. Symptoms of regular flu or common cold will be similar to these, although cold symptoms will usually be milder. If you or your family do get sick with the flu, you should take steps to take care of yourself or your family members at home before going to the clinic or health center. It is likely that our healthcare system will be extremely busy taking care of people with severe symptoms of H1N1. So self-care is recommended for most cases of influenza. In order to make preparations to take care of people sick with the flu, you should have the following items on hand: pain and fever medication with Tylenol or Advil, a thermometer, extra supplies of essential medication, cleaning supplies like household disinfectant, soap and alcohol-based disinfectant, soap and alcohol-based hand sanitizer to keep hands clean, non-perishable food like canned soup and fruits, vegetables and liquids like water and juice, in case you can't get to the grocery store. If you or your loved ones get flu-like symptoms and are otherwise healthy, it is best to stay home for recovery. Do not try and be a workplace hero and tough it out, as this will likely lengthen the time you are sick and make those around you sick as well. This is especially true for those that work handling food and in retail operations serving customers. To treat yourself or your family at home, Follow these guidelines. Encourage rest, dress light, and keep room cool if you have a fever. Drink cool liquids often. If your urine is dark, you need to drink more. Eat small, nutritious meals, even if your appetite is low. Monitor your temperature. Use pain relievers with acetaminophen like Tylenol and to reduce temperatures over 38.5 centigrade. Those containing ibuprofen like Motrin or Advil can be used for anyone over 6 months. ASA or aspirin should not be given to children or teenagers. There is a time, however, when it is best to seek medical attention. Those who are pregnant or having underlying health problems should go to their clinic or health center when they get flu-like symptoms. You should go as well if you are healthy but your symptoms worsen or you experience difficulty breathing or serious shortness of breath. It is best to be extra careful when caring for children under 2 years of age with the flu, which is more severe. You should take your child to the clinic or health center when he or she has signs of influenza and has lung or heart disease, has an illness or is taking treatment that affects the immune system, takes acetylsalicylic acid, ASA or aspirin, regularly for a medical condition or has any other chronic illness requiring regular medical care, is less than 3 months old and has a rectal temperature over 38.5 centigrade, has trouble breathing when resting, is wheezing, has chest pain when breathing, or is coughing up blood sputum, phlegm, or saliva, drinks very little fluid, has not urinated at least every 6 hours when awake, has been vomiting for more than 4 hours, or has severe diarrhea, is constantly irritable and will not calm down, is listless, not interested in playing with toys or unusually sleepy, still has a fever and is not feeling better after 5 days, or was feeling better and suddenly develops a new fever. It is an emergency if your child has severe trouble breathing or blue lips, is limp or unable to move, is hard to wake up or does not respond, has a stiff neck, seems confused, or has a seizure, convulsion, fit. If flu symptoms come quickly or are severe, and depending on your medical risk, a person may be prescribed antiviral medication. Antivirals are a prescription medication that help to reduce symptoms, shorten the length of illness, and reduce the chance of needing medications. A vaccine for H1N1 will be available by November 2009 for all Saskatchewan residents. This will produce an immunity to the disease and make it far less likely that you will contract H1N1. 2 doses may be required. Healthcare workers will inform you of the process once recommendations are finalized. The vaccine will be available free of charge to everyone who wants it throughout Saskatchewan. Immunization clinics will be offered in each health center or nursing station. Watch for information about clinics in your area. Traditional medicines can also be considered to help prevent or treat influenza. Many First Nations have identified traditional medicines to help maintain a healthy body. Particular types of plants and materials used may vary from community to community. If you are interested in knowing more about traditional medicines, talk to elders in your community. many of whom are keepers of the medicines and the knowledge required to use them. The Northern Intertribal Health Authority is preparing for H1N1 and other potential influenza pandemics. Elders have been consulted and healthcare workers are in place and trained to handle the situation. Public education is important, and copies of this video are available at health clinics and nursing stations. Please do your best to become informed and help control the spread of pandemic influenza. Let's work together to make each of NISA's 33 communities healthier.